Hello, everybody. So I'm gonna wait a few minutes till everyone can join. Hello, hello. Hello. Hello, everybody. Just gonna give it a couple minutes so that everyone can join, and then we will go ahead. Love you too. Then we will go ahead and bring on our guest speaker. We're gonna have a super fun talk. Hello. Thanks for joining us. And then definitely if you have any questions, please feel free to ask while we have our speaker with us. Don't mind my dogs making crazy noises in the background. So let me go ahead and log her on so she can introduce herself. I'm just gonna wait a few more moments for some more of our followers to join us so we can go ahead and add her. And we're going to be talking about orthopedics, so if you have any questions about your dogs or cats, this is the place for it. Any bone health questions, any post recovery questions. Hello, thank you Kevin Wartor for joining us. Hello everybody. I'm going to go ahead and add our guest speaker, and don't forget that we will be doing giveaways throughout, so any questions, definitely join. All right, let's go ahead and get our speaker. All right. Hello.
Hello.
Thank you
How
for
are you, Dr.
joining
McFarlane?
us. Doing great, Doc. How are you doing?
I'm doing well myself. Thank you for having me. Very
So
excited to be here.
thank you for joining us. I'm just letting some people join us, giving them a couple minutes to get on. And I'm really excited to have you here. I told everyone we'll be talking about some orthopedic things, about cats and dogs, and any questions they may have about bone health, mobility, recovery from surgery. Some of these topics that we'll go through. And then, oh, Cass, yay, Kayla, love you, beauties. Oh, I guess we have some fans. So we'll go ahead and we can get started actually as soon as you're ready. I'll let you introduce yourself to our team here and everyone that is here. You guys, if you have questions, please go ahead and ask away.
Hi, everyone. Like Dr. McFarlane said, my name is Kayla Caturay, and right now I have just moved from the very gray New England area to the
Oh,
residency in small animal surgery. And what
hey,
that
Dr.
means is
Caturay, can
after,
you repeat that? I think
yes,
we lost the signal for a second. Sorry. You were just saying
no
you had moved.
problem. Yes, I am back in sunny California. I just finished my small animal surgery residency in New England. And what that means is for the past 3 years, I've done advanced training after veterinary school to really focus on surgical conditions that affect our dogs and cats. So, in case you have any questions near or far, you can find me in San Mateo, and I'm happy to answer whatever questions you have today and even in the future.
Super awesome. Love it. Love it. Thank you for that intro. If we have anyone from California, this is our go-to right here. So let's start talking a little bit about, how can you tell if your pet is overweight? How about that?
That's a great question. It's something that is so commonly asked, or that unfortunately comes up as a surprise during some visits. And so, what we have to remember first and foremost, humans, we're all about the same size, even me next to a linebacker. In general, we don't have as much variety as all of our furry friends. Even if we take a quick peek at some dogs, we can already see just how many shapes and sizes we have to deal with. It makes it so hard for both veterinarians and pet owners to really know what they're looking at. And so before we get any surprises from the doctor, feel your pet. Pet your pet every day. Can you see a nice curved waist from the side? Maybe not in the winter months. That's okay. Or if you have a really furry dog or cat, it can be really hard to see that waist. So pet your pets. Feel along the sides if you can feel their ribs. That's actually okay. We don't want a really bony skeleton, but we also don't want it to be a little bit difficult to really press in there. And so, one nice resource I always like to provide to clients, and that I will do with my own pets as well, is to look at a body condition score chart. And so, what that means is for both dogs and cats, there are systems where you can gauge if your pet is too thin, If even your cat might be a little bit too fat, which often our indoor cats are, and we see a really robust fat pad swinging when they run. And as cute as it is, and as protective as it may be for some outdoor cats, if we can eliminate that little pooch, it's hard for cats, but in cats and dogs, a couple pounds goes a really long way. And so making sure to look at your dog and cat from both the top and the side. If you're a short-haired dog, great to see that glimmer of the ribs at a walk. Even if you're a nice, fluffy Akita or a really round lab, we certainly don't want to be able to see an eggplant shape from the top.
Love it. And then for this resource, will you be able to send these links to us at the end of the conversation so people can have these tools at home?
Absolutely. Everything is free. And in case you want a hard copy, you can also maybe even find one at your vet too.
Perfect. Super. Because I think these are good tools to have at home. That way, you don't know, like sometimes your pet might be looking a little on the thicker side. And these are just things to kind of monitor when you go to the vet. How many pounds has he gained compared to last year? Just tools to have at home. So I think they're very beneficial to some of the clients that have these pets at home.
I agree. And fortunately, you nor I really have to deal with seasons, but certainly if you are in a wintry area, something where your activities are affected by the seasons, it's also okay to shave some of those kibbles off the top. That way, we're not putting too many calories in, then our pet's expending out.
Super. Yeah, we definitely try to talk about like some low calorie treats, like some fruits here, like a little pop of blueberries, little things like that that could be beneficial versus like tons of treats, especially during the winter times, like you're saying. So another question for you.
Absolutely.
What type of activities are good for pets? Would you recommend?
That's a great question. And it's something that's very unique to every family and unique to every dog. I know that I certainly got my dog with the hope that I'd be able to throw a ball and he would come fetch it for me yards and yards away. But Dembe did not like that. He wanted to get the ball once and then lay down and chew it. And so, in terms of activities, first, see what your pet likes. If they love to stand up on the couch and just watch everything go by, that's great for their hips. They're keeping their quads and their gluteal muscles nice and strong. Really good to keep those back legs healthy, their knees, their hips. Keeping that activity available to them, even if it's to look outside, that's okay. That way they can look, have some mental stimulation, sniff if you can open a window. And if your dog needs a job, needs to run those miles in a day, make the time if you can, or even options like a puzzle toy, just like your fall time frozen treat. That's perfect. Get those front paws engaged. Sometimes, if it is on something like a surface, they can engage their core, really work at it as well. And so, even if things seem static, engaging them inside and outside with what they want will really help to both increase your bond with your pet as well as to just get them outside or even inside and doing things that they like.
Perfect. Is there like a recommendation or some sort of like guidelines for activities you would say, whether like they're younger or older dogs?
I would say yes. And it's really hard to know what age is the right age for a puppy. There are a lot of myths and old wives' tales about not running your dog too early while the growth plates are open. Really hard to say in our larger and giant breed dogs, especially what that safe age is. So I would recommend letting your dog do easy, non-strenuous walks. I wouldn't take them on a big 14,000 elevation hike quite yet as a puppy. So first, leash training, go around the block, introduce them to different terrains when they're young. Grass, gravel, hills, dirt. Turf is something that my 12-year-old dog experienced for the first time and did not like it as an adult. So keep that in mind. Some dog parks are now turf. And so introduce all these things. Sand is really great. Once your
Yes.
dog is appropriately behaved outside, got some good manners, fully vaccinated, pretty much full grown at about a year or so, maybe consider some of those more strenuous activities. Certainly, if you're a farming dog or an agility family, you're going to be working on some things as their training develops around 6 months or whatever age you want to start.
Super. What
Yeah.
about swimming? Is that an option?
I love that question. Yes, swimming, I love. It is so nice for pets with orthopedic disease. Not only are you getting nice range of motion, some resistance as they go, it is really non-concussive in terms of activities compared to fetch, running off the dock, diving into the water. And so if your pet likes water, please let them swim. Now make sure their ears are dry after. Make sure that their coat is nice and clean, no plants, thorns stuck in there. But swimming is such a great option for pets any age. Make sure that you have an eye on them. And something that is not always thought of in water sports is they use their talons and to lever themselves. So
Oh, wait, you
swimmer's
broke up. I
tail.
think this is a super point. Can you just repeat the little piece about the boards?
Absolutely. So if you have a pet who's swimming or on a paddleboard, they're using their tail to try and balance. So while swimming is great, keep in mind that dogs and cats use their tails. And so swimmer's tail is real. And you might see a droopy tail a day or so after. And sometimes it really, really hurts and they just want to wag their tails. But keep in mind, non-concussive activities are great, but everything in moderation.
Absolutely. Love that. Super. Do you see a common disease in puppies that you think people can look out for easily? Would you say one or two that you can have like at the top of your head for like orthopedic issues?
For sure. Whenever thinking about introducing a member of your family, I think it's nice to know about at least some of the most common things that you might encounter. And so, something that a lot of the media has covered, we've heard for nutrition commercials, large breed dogs, is hip dysplasia. And those are just big fancy. Your fit is not quite as perfect as it could be in the hip joint. So, that is
Okay.
And what we want is a really, really nice, deep cup of the hip to fit in with our thigh bone so that when we have our pets walking, it's not sliding around. When we have ill fitting of that ball and socket joint, if we don't have good coverage, what we have when a puppy walks is a lot of motion. The muscles don't like that, the soft tissues don't like it, and certainly bones don't like to rub against each other either. And so, if you see, especially if you have a large breed puppy, a little bit of difficulty getting up,
Mm-hmm.
maybe even limping, or perhaps biting or turning to guard the back end when you go to pet your new puppy. Keep that in mind that sometimes discomfort, they can show different behaviors to protect themselves. And so ask your vet about hip dysplasia. Not every lameness or limp is because of a hip, but something to keep in mind, especially keeping your pet nice and lean and active throughout
Yeah.
their lives.
Yes, I'll touch a little bit on about that. Absolutely, that last piece she mentioned. My dog has hip dysplasia. She had it as a puppy, and keeping them lean is gonna, would you say, increase their lifespan as much as possible? Just because you're letting them have so much less tension and so much less buildup and just wear and tear throughout that time of their life.
Absolutely. And lean, they're going to be around a lot longer. They're going to feel a bit better. Certainly, we have treatment options that are both surgical and non-surgical for pets. Belle has been a great example of truly keeping her nice and fit, being active, keeping her muscles in good condition, where she's doing great as a lean dog. So, although looks are not everything,
Yeah,
having a thin waist goes a long way for our dogs and cats.
agreed. Agreed. So let's move on to something that you were just talking about. So, what if my pet needs orthopedic surgery?
Yeah, surgery is a big, scary word sometimes. And there are so many things that are different in our dogs and cats, also that are quite the same. And so if you have a pet who's either a couch potato or even one who might be a predisposed breed or a poster child for a certain thing like an ACL tear,
Yeah.
first and foremost, show us what you're seeing. I love when a client brings a video or has a pattern for, hey, my dog limps every time we play ball. She gets better after a few days of rest, but here's what I'm seeing because I saw it at home. Maybe your pet's not limping when you come in. And so if your pet needs surgery, come on in, whether it's your general practitioner, straight to a surgery consult. Hopefully, it's not an ER visit, but certainly things happen, things can be traumatic. Come see your vet. We'll do a good orthopedic exam at home. Something to think about first is check your paws and toes. Get between in there, spread the fur. Sometimes it can be something like a bee stinger, a thorn, or a burr. So before bringing your pet on in, do a first look over, quick little peek, feel around. If your pet is comfortable enough, you can even start to feel along the leg if they let you. Don't push them, but certainly do a quick look over first. The more information you can give us, great.
Super.
And so we will let you know a diagnosis however we can. Exam, diagnostics like imaging, x-rays, maybe even a CAT scan. We'll hopefully find that problem and talk about what surgery means. And I think something that scares a lot of people is a bad haircut and also the cone of shame.
Yes, yes, huge point. Cone of shame. Not very. A lot of people are not fans. Not fans.
And I think we've done a disservice calling it that, a cone of shame. Really, we can call it something else like just a cone. There are different options, like a soft cone. If you have a pug or a bulldog, maybe you don't need a satellite dish, but a cute decorative watermelon slice can be your summer look as we recover from itchy feet. Keep
Yes.
those tongues away. If we have more of a long nose, like a German Shepherd, a Greyhound, then unfortunately, we're talking about something to go beyond where they can lick. And so keep the incision nice and protected if your pet needs surgery. I'd much rather 2 weeks of tough love than starting from day zero after a 2 week surgical recovery. Or if we're talking about an 8 to 12 week recovery, let's protect everyone's sanity and health as much as possible. 2 weeks in a cone, we can help with enrichment, medications to make it stress free. We've got hard cone options, soft Velcro, ones that you can even flip back so your pet can see and eat.
Yeah.
And now we even have options like sleeves and material that can be slid over an incision, buckled over the back, and machine washable at home.
Yeah.
So ask your vet, shoot us a question, or if you want some links, we're happy to provide those too. But they don't always know that not licking is good. So we have to help them out sometimes.
That was my next question. All right. So I've seen a lot of those bodysuits now, for like
Mhm.
protection of the lesion. You would recommend using some of those if appropriate for the incision?
It depends. And I think what's hard is that sometimes the buttons and seams don't quite line up on your pet's body. So, first, if they lick it, then we have a saturated saliva cloth on the incision. So, make sure it's clean and dry, machine wash if able, and don't be afraid to bring it to the discharge from the hospital. I like to have our nurses fit things for some families, show them how to put it on, and also to
Oh,
interactive types of discharges to show people what to look for. And also, if you're with your pet sitting on the couch, you can give them a break. If you go to the bathroom, put the cone or the
put
seat
it
back
on.
on.
Yes.
Hmm.
It only takes a minute. It only takes a
They
minute.
are quick and motivated sometimes.
All right. So what about like non-surgical procedures or treatments? Can you touch about those a
Great.
little bit? And hello,
Yes.
everybody. I know you guys have been saying hello to all of us, and I've just hello, hello. They've all been saying hi. Thank you
Welcome.
for joining us and coming in.
Well, happy to have you. Perfect timing. So, what are other options for non surgery? And as much as I love doing surgery, that does not mean we need to do it for every pet. And so I will say that some of the most frustrating conditions can be the ones that don't have a surgery
Okay.
because you're working on PT, and in vet med, it's more appropriate to call it physical rehabilitation. So often PT for physical therapy on the human side, who you're looking for would be a veterinarian who is certified in rehabilitation. You might be seeing a veterinarian who's specialized in sports medicine or even mobility medicine. We don't have a chiropractor necessarily. All of these things are kind of encompassed. And so, one thing that you could consider if you are going to go to a place or have them come to you is veterinary rehab. And these can be things, my dog isn't food motivated, so it's hard for me to get her to walk. She's getting a little bit chunky because I don't know how to exercise her. That would be very different than someone who is going for pre or post operative physical rehabilitation. And so we have a lot of different options to slim down, to actually build up muscle mass for those pets who've got to keep working and build up some of their own instead of losing. And the best way would be to be there with the nutritionist too. Of course, it's not always available, but having a nice little workout plan that you can either do with your pet once a week, even continue at home, that is one option that either you can do as an activity together, have someone come to your house, and it's something that can really, really help both training during a period where training's hard and also bonding. And for pets who don't like rehab, some vets offer other things like laser or acupuncture. And if it is even available to do something like shockwave therapy and your pet tolerates it, there are a lot of options now in a lot of these areas that I am sure in the Miami area too, you would have
Yeah.
some great resources.
Yeah, there's definitely a lot of options. I think it's
Hmm.
more of the people knowing what to look for and where to look for it. So just having this exposure is good because there's people who don't know about these other things versus, like I don't, can I only put my dog in a cast versus, all right, let's try some laser therapy. And then let's move
Yeah.
on to like, what about supplements? How do you feel about that in terms of like joints?
Great. And especially with having a doggy bakery and being mindful of what kinds of foods go into that, it is something where nutrition can do so much. So there are a few different veterinary formulated joint supplements. How good is a vitamin for us? Sometimes we don't know.
Yeah.
Some dogs do great when they're on fish oil and don't tolerate a veterinary formulated treat or two. And so, if your dog likes something that has omega 3s, ideally a balance of the different omegas, that can be I'm going to buy it over the counter at Costco. Or, like me, I don't like to think about it. So I give my dog a joint chew that is all encompassed. My other dog is on a joint diet. And so, from over the counter to prescription options, there are things that we can give our pets on a daily basis that'll help keep those joints nice and lubricated, just like people eating less inflammatory foods and having those different types of fats. That's where the foundation of all these nutraceuticals or supplements come from. If it gives your dog diarrhea, I would say don't bother. Get them regulated first and then see what works. People have pets who really smell like fish when they take the fish oil supplements and they cannot handle how their dog smells. So see what works for you and your pet. And prescription joint diets can be expensive, but if your dog likes it, it's all in one. Great.
Right. Love that. Do you think that, as your dog is aging, you should like appropriate its diet to make sure you encompass these things, not just keep them on the same diet their whole life?
Absolutely. And I love when people think about what their pet is going to eat at various stages. And so I've now crossed into 7+ year age. So we're in
Me
geriatric
too.
territory. So
Me
Dr. McFarlane and I have litter mates from vet school. And so
too.
we've got our black and tan dogs growing a gray muzzle. And so now he is on a senior and vitality diet, meaning as we age isn't a disease, but age slows things down.
Yeah.
Metabolism is a bit different. So, unfortunately, just like people, they can pack on pounds as they get older just because things aren't moving as much. And maybe they're not, whether it's joint related or not. Having those types of diets for 7+, let's say it's even 7+ sensitive skin, If it is a limited ingredient, certainly talk to your vet about options to make sure that your pet is getting what they need. And keep in mind, all of these things have calories that can add up. So if they're going to start a new supplement, maybe check to see how much kibble is in the cup, see how your ribs feel, and then go from there to see what'll work best for your pet. Or even things like putting a yoga mat or a welcome mat at the end of the stairs so that they have good grip to get on and off those ledges. A little bit of easier impact as they come off on those joints too.
Perfect. Yeah. What about these stairs for like going onto your bed and couches? Do you recommend them as they age, or even just like when you're having, Frenchies or smaller, longer sized dogs? What do you think about those stairs for these kind of situations?
Yes. I'm a proud owner of two different pet stairs now, and I
Love
love
that.
stairs. And I think it's become a little bit of a misconception that, oh no, now we have a back problem. I should train my dog to use stairs, or now we've had surgery. I should start stairs. Now, instead of having this new object in an already different time, try and introduce that earlier in life. Start it with the training in puppies. So if you have a breed that we know is predisposed to slipping a back disc, like a Frenchie or a Dachshund,
Doxies in the
exactly.
comments.
Yes, Jamie Payne. So just like that, lay some nice treats up those stairs, make it a safe place, show your pet to use that both on and off of those surfaces. Preventing jumping down is going to protect those forelimbs and the neck. If you are jumping up, you're going to be using your back legs. And so those are when we want our hip dogs to be using stairs to go up. So I say pet ramps and stairs,
All the
good
way.
flooring. If you can do it while young, great. And you know what? Maybe that extra little cushion and support will help in the long run.
Super. We do have a question in the comments.
Yes.
Is it possible, as like in humans, to help cartilage with HA, hyaluronic acid?
And HA has become such a huge product in serums for humans' faces. Injections into horses is a lot of what our veterinary medicine is known for. The answer is possibly.
Yes.
Your vet can administer HA into the joint. Is it a best treatment? Absolutely. We don't know yet. There are a lot of different options to be injected into the joint, whether that is hyaluronic acid. Some people think of some of these things like an oil change for the joints. What we want is to promote a nice, squishy joint in there to help us take these sharp movements, cushion, and protect our cartilage. Does HA work? Sometimes in certain pets, we don't know what's better between what's called this class of regenerative medicine. That could be PRP or platelet rich plasma. There are also devices now that are called biologic devices that you can inject into the knee with the thought to act as a true spring and absorb shock with a true device. And some of these you actually need to have administered at a very special facility because you could be radioactive. So, from
Yeah.
HA that you put on your face into the joint, all the way to these radioactive biologic devices, there are a lot of things that we're looking at because arthritis is such a hard condition to manage. It's a long-winded way of answering, I hope, your question.
She said, thank you. So if you guys have questions, please put them in there. We've been talking about a lot of different things for bone health, from young to your older dogs, pros and tips, diets, tools that you can use to help. If you guys have any questions, just throw them in the chat. We're going through any questions. We appreciate all the love. I've seen you guys saying hello to both her and I. So really, really appreciate you guys being on here. So we're going to put all these resources that she's talked about on our chat. And once we post the live, if you have questions, we can also DM you these things. So please use this time to ask any questions you may have. Definitely we'll leave you guys with some take-home messages as soon as we'll wrap up. We do have one giveaway we want to give out. So if you guys have been on, I think Dr. Caturay is going to have a question, and then we can do some little things here and there before we wrap up. But I want to make sure we give you guys some time to ask any questions you may have before we close up shortly. So, Doc, do you have any other tips that our listeners could do at home with their, either young or older dog to make sure that they're not missing some sort of pain or some sort of change in motion on their dog?
Yeah, great question. First and foremost, watch your dog. If you go out on a walk and you notice, we usually get to this part of the block in this amount of time and we're slowing down. There are a few newer things in vet med about what slowing down means and how it's so easy to miss some signs of aging that actually just aren't true aging. And so take a peek, if you get to that point of the podcast much earlier in your walk or vice versa, kind of take a note of that. If your pet is hesitant to come up or down the stairs or a bed, certainly things to think about with, maybe just that extra impact is a bit uncomfortable. And if you want to try something like a diet, a supplement, keep in mind that those are going to take a few weeks to take effect.
Yeah, it's not immediate. I know people
hmm
rush and they're like, oh, it didn't work, but yes, that's a super solid point.
And don't be afraid to take the time to rest. And I think that that's a tough thing to do, especially because we want to be active with our pets. If your pet looks like they're hurting, a true rest means in a small area to lay down, sleep, and eat, on a leash, go out for a potty break, sniff, sniff, and back inside. 2 weeks. So, again, if you really want to see if rest will help, try a true period of rest so that you're not battling something for a lot longer because you're staying active.
Super. We have a question. So my dog is
hmm
turning 7 next year. What diet do you recommend? Keto, paleo, question mark. What kind?
Great. And do you have time to let us know? Is it a big dog or a little dog? A 7-year-old Great Dane is unfortunately a lot older than a 7-year-old Pomeranian.
Golden retriever.
All right. Oh, what a great breed. Hopefully a luscious
Right?
golden coat.
Yes.
Yes. And
Huge
so
family dog.
for, for a golden retriever, that is where we start to think about shifting into the more mature adult phase in life. And unfortunately, Goldens are known for joint disease too. I would say that if your pet doesn't have any sort of stomach sensitivities or food allergies, something that is a well balanced diet, those are commercial and over the counter. They're from the big four veterinary brands. And so I can pop a few adult and joint diets in the chat for you. And again, a lot of these are over the counter. There are prescription options. I would say that I wouldn't shift to something that will take away what they need as a balanced diet with vitamins and minerals. And that's what those commercial diets have. Even if they're kibble or one of those partially fresh diets, we want something that has all the things that they need.
Super. Perfect. Yeah, so we'll do that, put that in after we post this so you guys can go back to the resources. The other question is, any tips for post TPLO surgeries? Dr. Bruno.
Dr. Bruno, great. Yes, post TPLO. First, keep that cone on until the incision is healed. Once the incision is healed, this is an active recovery. So we don't want to be carrying the leg all four on the floor. The bone likes the stress and the weight bearing to stimulate healing. So, as easy as it is to go quick and carry the leg, take that painfully slow pace for your dog to go step by step throughout recovery. And everyone's going to be walking and getting those toned legs during a TPLO recovery. So, multiple frequent walks. So, for example, 4 20-minute walks, that's going to be actually a lot better than 1 2-hour walk in a day. So, keep moving, keep all four on the floor. If your dog lets you do things like slight inclines, great. Build up those gluteal muscles and see, strong thighs, they go a long way.
Yes, yes. We have one other question. Is anything that we can do or use if your dog is constantly getting sprains because he's very active and loves to run?
Oh, it's so hard when the thing that makes them the happiest is what makes them limp after. And it is one of the things where I say, do as much as your dog wants to. But if you know that activity makes him sore and limp, afterward, we can kind of treat them as we might ourselves with a pre-activity and or post-activity pain medication. Make sure that it's labeled for your pet, whether it's a non-steroidal anti-inflammatory or if it's something like over-the-counter acetaminophen. And these medications are all dog safe. Make sure you ask your veterinarian what the dose is. But
Yes.
you can say, I know that we're going to go to the lake this weekend and he loves to swim. He's going to be sore. Go ahead and give them a pain medication before and or after, and then let them rest. Give them some cushy beds if they like, plenty of water. And again, think about having surfaces that give them good traction so that when they're getting in and out of bed, in and out of the car, it's not an extra struggle for them either.
Super. Love that. Love
Yeah,
that. And hopefully she answered your question. And
yeah,
then I think we'll do our giveaway question if you're ready, Doc.
perfect.
You can let the question out, and then it's almost every day. Yeah, so you can try what she was saying, but like she said, make sure that you consult with your veterinarian on a dose.
And if it's every day, you can even do, all right, we're going to scale it back to ground zero, 1 5-minute walk for a few days, no limping. Oh, he is limping when he gets up, but he warms out of it. Try and find a pattern. And if it's something like I can roll the ball instead of throw it, and that helps, great. So it might be a little bit of trial and error. Try and find a pattern and maybe even a journal and take those videos for your vet.
Yes, super. Super. Jotting
Yes.
it down is crucial.
So our giveaway, we talked about various activities for our pets. This is going to be a true or false question for a Doggy Bakery Miami giveaway.
The
True
first
or
two
false?
people to answer
Oh,
will get
yes.
first two people to answer the correct answer will be getting a bag of treats sent to their home on us. Let's
Ooh,
see.
okay. The question is true or false? Swimming is a good activity for pets with joint disease. Do, 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 do,
I'll let you
do,
repeat
do,
that just in
do.
case someone just joined or missed. So giveaway question,
Sure.
we need a true or false. Whoever gets it right, the first two answers gets a free bag of dog treats from us. Question.
All right. The question is, oh, we have a flood of answers coming in. True or false? Swimming is a good activity for pets with joint disease, if they like it.
All right. So we
Are we
definitely have
ready for the answer?
depends. It was a true or false question.
Swimming has less impact on the joints for the scientific minds I see than running.
So we're still getting answers. Okay, so
All
the,
right. Dr. McFarlane, what is your guess?
my guess is true.
Yes. Great. Why?
Like you,
Correct.
like like you said, less impact. I mean, it's something that I do with Belle, my dog who has hip dysplasia. It's nothing better than either sand or water for her to be able to run as fast as she can and not come home limping.
Great. So there's a little bit of a broad question. Great job to those who answered true and depends. So if your dog is a dog who likes water, you like water and can swim yourself, everyone is safe. Swimming is a good option for pets with orthopedic disease from a non-concussive standpoint, meaning when they jump up, that puts a lot of strain on the back legs. Jumping down and landing after catching a frisbee, for example, can put a lot of strain on the front legs or the back. And so, if we want to keep our joints moving without too much step and step and step impact, see if your dog likes swimming. A life vest, if they're not chafing, if they get a little bit tired, keep in mind we always have to build stamina. But if they like to swim, great opportunity for those joints to get moving.
Super. Love it. I'm just writing down the top two and I'll DM you guys so we can send you guys the treats. Thank you all for participating on our
Yes.
questions. Would love to see my bulldogs swim. We would too. We would love to see them swim. Love that. Um, there's a lot of love and hearts being sent. Thank you guys for supporting and watching. I think Dr. Caturay is going to give us some take-home messages unless you guys have other questions, and then we can go from there.
Great. For those who might just be joining or coming into this past our time, please keep in mind three things from today's talk. One, stay lean, get outside, make sure that you pet your pets, feel those ribs subtly, look at them from the front, the top, the side. We want a nice tucked waist, keep them around for much longer. Pounds off to add on the years. Make sure that you find what your pet likes. So play with your pet inside, outside, tug, swimming, paddleboard, hiking. See what your pet likes and stay active together. And if at all you're concerned, whether it is your pet might be feeling a little bit gimpy, or if you just want to learn more about things to look for your pets and their orthopedic health, ask your veterinarian.
Love it. Love it. Love it. Definitely thank you. We have everyone saying thank you. Super informative. We want to say thank you guys. If you guys have any questions, definitely reach out after. We can always, let you guys know. We're going to send the links. We're going to post them. Thank you, Doc, for being here with us and sharing all of your amazing information with our viewers. I can't thank you enough for this time that you gave us. And thank you all for joining the live and watching us here. Thank you. Thank you.
So happy to be here. Have a great day, everyone. And again, please feel free to message me, and I'm Kayla Caturay.
Thank you all. And we'll post all the links, so don't you worry. And I'll be sending the two giveaways. So take care, everybody. Have a good night or good evening over there. Take care, Doc. Appreciate it.
Bye. Thanks.